What I would like to do is to show you that harm reduction is not just a theoretical construct, but it's really something that can yield important, significant effects, and that is reductions in death and disease. And on this very first slide, we can see what happened in my country. The blue is snus and nicotine pouches, and reddish is cigarettes. And as snus started to be more used, cigarettes started to be less used, and there is a communicating jar, and today there is more tobacco going to snus than to smoking cigarettes. And this has resulted in a very low smoking rate. In the very left of the picture here, you see Sweden, which is around 5% of daily smokers, compared with the rest of the European countries. And we see that Sweden is an outlier. If we were to look at tobacco use in Sweden, we would be at the same average as the European Union. That means cigarette smoking and snus use together. But this uptake of snus has resulted in something. And this is the most important slide that I have. And on the top, upper half of the slide, we see figures from World Health Organization, and we are looking at attributable deaths to tobacco per 100,000. And we have Sweden, if we go down to all causes, 222, while for the European Union, the median is 550. So that's quite a big difference, very big difference. And for all causes, the country that has next lowest figure is on 378, and Sweden 222. And we see the lower death rates in Sweden on lung cancer, other cancers, but also cardiovascular disease. And if we were to use another data set from the global burden of disease, we would see very much the same. So harm reduction is paying off. The global burden of disease, they have arrived to an interesting statement that I would like to read to you. There is sufficient evidence that chewing tobacco and other products of similar toxicity cause excess risk of oral and esophageal cancer, while at this time existing evidence does not support attributing burden to snus or similar smokeless tobacco products. And globally, smoking tobacco causes far more burden than smokeless tobacco. Because of that, Swedish snus was the first and so far the only product to be recognized as a less harmful tobacco product by the Federal Food and Drug Administration in the United States. And the former commissioner of FDA, he said, nicotine, while highly addictive, is delivered through products on a continuum of risk, as we have heard the two speakers before me. And that in order to successfully address cigarette addiction, we must make it possible for current adult smokers who still seek nicotine to get it from alternative and less harmful sources. And it so turns out that nicotine and tobacco is an ideal area for harm reduction. It's used largely because of nicotine, and pure nicotine, like in nicotine replacement products and even unburned tobacco, is not a big part of the problem. And the problem, that is the health consequences. It's not the prevalence. The prevalence, to have a low prevalence is a mean, but if prevalence of a use of something is not dangerous or very dangerous, I wouldn't care that much. What I care for, that is the harm, the death and disease. And it's funny, or no, it's not funny, it's sad actually. There is a lot of emotionality in tobacco control. For example, from the same data, European Union has banned snus, while FDA has given snus a marketing advantage as being a less harmful tobacco product. And if anything should be prohibited or banned or phased out, it should be cigarette smoking and not the alternative products. We have tried to figure out a little bit in Sweden what would have happened if we had no snus use. And under the assumptions here, we have all of snus users today would have smoked. Then we would have had 4,000 more deaths. However, it's unlikely that all the snus users would have smoked. So if we take a more conservative assumption that half of today's snus users would have smoked, then we would have 2,000 more deaths, or conversely, we are saving 2,000 deaths per year because of snus use. And if we compare 2,000 deaths to the death we have in traffic accidents, that is 227 per year. So you see the difference, how much public health benefits you could harvest from doing the right thing with tobacco control. And finally, I'm very glad to announce that the Swedish government has proposed in a proposition to the parliament that the tax on snus should be reduced by 20% and increased on cigarettes by 10%. And this is on health grounds. So my conclusion is that in Sweden, it has been the product snus that has displaced smoking. And snus has significantly reduced death and disease in Sweden. Thank you very much.